one of the most critical things to come out of, or the most critical thing to come out of any clinical study is the data. It's what Galen was just telling us about, right? It's how bankable, trustworthy, and credible is the data. So I'm curious, can you talk to us about, did the data you received off the back of your trials, did it equate to the tier 1 data that like the FDA looks for?
In our case, yes, the equivalent data from Australia and over the European data was now. So yeah, it's there's no variation on that side.
Yeah, so FDA, in order for all US data to be accepted by the FDA, you would need 2 requirements. One is your study needs to be done in compliance with the GCP requirement. 2, the data needs to be read to US patient population and the US sponsors. So this says that if you go to a region to do study with a unique patient population, for example, if you go to Asia, your data may not be applicable to US patient population. And if you go to a place to do your first human study, say in a region that their medical practice is very different from US, then your data may not be viewed as applicable to US practice. So these are the requirements. So that's part of it is a regulatory requirement. Another part of it, I think, is really in order for you to raise next round of money, and you need good quality data. Your data needs to be trusted by other people, by the manufacturers. If you want to have strategics in your next round, they could look at the data with microscope, and they typically go through everything you've done. They want to see your data, your study data is solid, so that they feel comfortable. They don't need to repeat the study in US. So I think all these are very important to consider.
You know, that reminds me of something Jonathan said during the opening comments. He was like, for strategics, they are mostly interested in post-data pre-revenue, right? So they're really going to go through that data with a fine-tooth comb.
They do detail, like extrinsic all the invest in your pivotal round, for example, and that happens. So after you finish your first in-human study, your data needs to be solid, so that when strategics comes and look at it, say, okay, this is real.
And you know, I'm here on behalf of Ascend and doing clinical research in Australia, but I would be remiss if I didn't share with all of you. There are other parts of the world where you can explore clinical research. Poland is an excellent location. We were having a conversation earlier about Georgia. Some political instability or uncertainty there is rendering that may not be, the best choice right now. There are other centers of excellence throughout the world. However, there are also centers that people go to save money, but there is a consequence to that decision. So there are some Latin American destinations that people go to because, I can get it done inexpensively. The problem with that is that the data is not going to be as highly regarded as Leanne just said. And since the goal is the data, you might need to invest on the upfront to get that goal on the back end.